Now we talk about school oral health programs. Learning about your oral health, Turtle Tooth program, Scout dental demonstration, North California statewide prevention program, Head Start preschool dental health program, SHARP, Theta, Colgate Bright Smile Bright Future, WHO's Global School Health Initiative. So all these programs are there. First one is learning about your oral health. A prevention-oriented school program. So this program was developed by the ADA and their consultants in coordination with the 1971 ADA House of Delegates, and is presently available to school system throughout the United States of America. Okay, so the primary goal of this program is to develop the knowledge, skill, and attitudes needed for prevention of dental disease among the school children. And consideration is also given to increasing knowledge regarding diet and dental health, stressing on the relationship of sugar, starch, and caries. The other topics included in this program are the significance of fluoride, oral safety, consumer health concept, the role of dental professionals, and the relationship of oral health with total health. Community dentistry is very, very boring. Implementation of the program. The program is divided into 5 levels, and each level having its own defined specific content. Level 1, 2, 3, 4. Level 1 is from kindergarten through grade 3. Okay, I'll write it for you. Kindergarten to grade 3, and then level 2 is from grade 4 to grade 6. Level 3 is from grade 7 to grade 9, and level 4 is from grade 10 to 12. Okay, so the core material for each of the 5 levels is self-contained in the teacher's packet, in the teaching packet you can say. That allows the classroom teacher to adapt the presentation to the needs of the student. So we have a teaching packet which has a guide, a teacher's self-contained guide on dental health fact, with a section on handicapped children. Also, they have a glossary of dental health terms. They also have curriculum guided featuring content, goals, behavioral objectives, and suggested activities for other classes, and 5 lesson plans for the prescribed level and 7 or more lesson plans for each of the other levels. And they have 4 overheaded transparencies, as you can see here. And also have 12 spirit masters for copying, and the methods and activities for parental involvement. And yeah, this is not the methods and activities. This is actually the CD or film which is suitable for each level. That is also provided to the teachers in the teaching packet. Turtle Tooth program. So Turtle Tooth program, Texas statewide preventive dentistry program. So Turtle Tooth program was developed in 1974 to 1976 as a cooperative effort between Texas Dental Health Professional Organization, the Texas Department of Health, and the Texas Education Agency through a grant from the Department of Health and Human Services to the Bureau of Dental Health. The program was pilot tested in 1975 and field tested in spring 1976 in schools within the state of Texas. So what happened is, in 1989, the Bureau of Dental Health developed a new program, which is the Turtle Tooth program, to replace the existing program. So this was the Turtle Tooth program, and it was new generation for grade kindergarten to 6, and new curriculum was obtained from formative evaluation, and separate lesson plans were developed for each grade, and a system approach was used to develop all the educational material. So 3 videotapes were produced as a part of teacher training package. So the first videotape familiarizes teacher with the lesson format and content, and second videotape gives information about brushing and flossing. It was developed for a dual purpose of the teacher training as an educational unit to be used by teacher with the student. And background information A third videotape provides teacher with additional background information as a means of preparing them to teach the lessons. Okay. And the materials that were developed to aid in the implementation of program consisted of a brochure that provided an overview of the program and school nurse brochure. Now, program philosophy and goals. So the program elaborates 6 elements of effective lesson design: anticipatory set, setting the objectives, input modeling, checking the understanding, guided practice, independent practice. Program implementation. So, the Texas Department of Health employs 16 hygienists in the 8 public health regions to implement the title to the program. So, the hygienist instructs the teacher using videotapes designed for teacher training and provide them with a copy of curriculum. Health promotion activities are encouraged and publicized within the school community, and teachers are encouraged to invite a dental professional to demonstrate brushing and flossing in the classroom. A field trip to a dental office is strongly recommended for kindergarten children. And then we have the bulletin board suggestion, a book list, film, videotape are available, and all those things. So, program evaluation. The students in the grade 3, 5, 7, 9, 11 were given the Texas Assessment of Academic Skill, which is the TAS, by the Texas Education Agency to satisfy the legislative requirement that student performance be assessed. Now we talk about the ZJXOR dental demonstration. ZJXOR is a small farming community, okay, with the population mostly of Danish extraction. It showed very high dental caries in initial surveys made in 1943 and 1946. So during the period from 1949 to 1957, the section on dental health of the Minnesota Department of Health supervised a demonstration school health program in ZJXOR, including caries prevention and control, dental health education, and dental care. So the exception was that the communal water fluoridation was not given in this, okay, and very good findings were found out that there is 28% reduction in dental caries in deciduous teeth of children aged 3 to 5 years. And so the program had certain benefits like good health and dietary habits for children to carry on to the adult life. But the cost was greater and the caries reduction smaller because water fluoridation was not given here. So this was it. North Carolina statewide preventive dental health program. In 1970, the North Carolina Dental Society passed resolution advocating a strong preventive dental disease program, embracing school and community fluoridation, fluoride treatment for school children, plaque control education in school and communities, and continuing education and prevention of dental professional. In 1973, Frankie Law prepared a report for the North Carolina Dental Society that defined the extent of the dental disease problem, and this resulted in the initiation of a 10-year program to reduce dental disease. Steering committee developed a practical plan for a program in school. This was the first statewide program of its magnitude. Then NCPDPC, continuation and expansion of the North Carolina Preventive Dentistry Program for Children, which is NCPDPC, has been made possible through incremental funding from the state legislature and funding through grant awarded by Kate B. Reynolds Health Care Trust. So these projects include producing 19 videotapes for classroom teachers and in teaching dental health, and conducting a statewide oral health survey of a representative sample of North Carolina school children from kindergarten through grade 12 during 1986 to 87. Program philosophy and goals. So the program is unique. Public and private partnership dedicated to the mission of assuring conditions in which the North Carolina citizens can achieve optimal oral health. So the program activities include preventive and educational components to modify the behavior patterns of individuals to improve their oral health, okay, through dietary changes to the brushing and flossing. So, young children are the primary focus of education because the earlier the child is reached, the greater the potential for positively affecting the child's attitude, values, and behavior. So, objective that will facilitate attainment of the goal, that is, appropriate fluoride use, health education in school and communities, and availability of school dental staff in all the countries. This program is unique, as already told, because it reaches several segments of population: young children, parents, teachers, dental professionals, and community leaders. The curriculum framework for dental health education includes a classroom and a teacher, videos and teacher guides for kindergarten through grade 6 to help teachers to be more effective in the classroom. Several additional teaching aids are available, such as more than 50 different leaflet, worksheets, and handouts in nutrition, fluoride, plaque control, routine dental visit, injury prevention, and smokeless tobacco. The film library contains some 30 film videos and slide sets on dental health, which are free on loan to any school in the state. Alright, Head Start Preschool Dental Health Program. So it is a program of United States Department of Health and Human Services, which was initiated in 1965, and that focuses on assisting children from low-income families. It is longest running program for stopping the cycle of poverty in the United States, and it provides comprehensive education, health, nutrition, and parent involvement services to low-income children and their families. School Health Additional Referral Program, SHARP. So it is motivation through home visit. This program was instituted in Philadelphia with the purpose of motivating parents into initiating action for correction of defects in the children through effective utilization of community resources. The project was carried out by district nurses with the cooperation of school personnel. The nurses made daytime visit to families in which the mother were at home. Working parents were contacted by phone. The one-to-one basis of health guidance between parent and the health worker established better rapport between school and the home. Now, THETA program, which is the Teenage Health Education Teaching Assistance Program, developed by the National Foundation for the Prevention of Oral Disease for the U.S. Department of Health and Welfare, Davidson of Dental Health. Philosophy. So, dental personnel train high school children to teach preventive dentistry to elementary school children. Goals: to give knowledge and skills to young children, allows high school children to develop understanding of young children and introduce them to career opportunities. Now we come to our very own Colgate. Colgate Bright Smile, Bright Futures. So Colgate Bright Smile, Bright Future oral health educational program worldwide was developed to teach the children positive oral health habit of basic hygiene. Let me do it first. Basic hygiene, diet and physical activity. So this program also encourages dental professional, public health officials, civic leaders, and most importantly parents and educators to come together to emphasize the importance of oral health as a part of child overall physical and emotional development. So under this program, children in primary school receive instructions in dental care from the members of the dental profession nominated by the Indian Dental Association. Education is imparted with the aid of audiovisual aids, and printed literature. Free dental health care packs are distributed to encourage good oral hygiene. Throw it away. WHO's Global School Health Initiative, launched in 1995, seeks to mobilize and strengthen the health promotion and education activities of local, national, regional, and global levels. The initiative is designed to improve the health of students, school personnel, families, and other members of the community through school. Strategies are: research to improve school health program, building capacity to advocate for improved school health program, strengthening the national capacity, creating networks and alliances for the development of health promoting schools. So, research to improve school health program. So, evaluation, research, and expert opinion is analyzed and consolidated to describe the nature and effectiveness of school health program. Building capacity to advocate for improved school health program. Technical documents are generated in this, so that they consolidate research and expert opinion. about the nature, scope, effectiveness of the school health program. Each advocacy document makes a strong case for addressing an important health program. Health problem, baby. Identifies components of a comprehensive school health program and provides guidance in integrating the issue into the components. Now, strengthening national capacity, collaboration between health and education agencies is fostered, and countries are helped to develop strategies and programs to improve health through schools. Creating network and alliances for the development of health promoting school, initiating regional network and global alliances with educational international centers for disease control and prevention, CDC, Educational Development Center, UNESCO, blah blah blah. Now we talk about what is health promoting school. A health promoting school can be characterized as a school constantly strengthening its capacity as a health setting for living, learning, and working. WHO TRS 870. So, it fosters health and learning with all the measures at its disposal, engages health and education officials, teachers unions, student, parent, health providers, and community leaders in effort to make school a healthy place. It strives to provide a healthy environment, school health education, and school health services, along with school community projects and outreach, health promotion program for staff, nutrition and food safety program, opportunities for physical education and recreation, and program for counseling, social support, and mental health program. Implement policies and practices that respect an individual's well-being, dignity, and provide multiple opportunities for success and acknowledge good efforts and intentions as well as personal achievement. Strive to improve the health of school personnel, families, and community members as well as pupils, and work with community leaders to help them understand how the community contributes to and undermines the health and education. Now, health promoting school focus on incremental care. So, incremental care can be defined as periodic care so spaced that increments of dental disease are treated at the earliest time, consistent with the proper diagnosis and operating efficiency in such a way that there is no accumulation of dental needs beyond the minimum. So, in private practice, 6 months is the commonest, the only interval between the visit. In public health program, 1-year intervals are usually implemented. This represents the ideal pattern of care where appreciable incidence of new dental disease is given. Let me do it once again. Treatment programs can be gotten off the ground by taking the youngest available group in the first year and carrying it forward in subsequent years as far as funds permit, each year adding a new class of children at the next earliest available age until an entire child population is being served to as high an age as available resources permit. Advantages. Lesions of dental caries are treated before there has been a chance for pulpal involvement. Periodontal disease intercepted at or near the beginning. Topical and other preventive measures are maintained on periodic basis. Bills for dental services are equalized and regularly spaced. The program avoids the high expenditure of late dental caries. It confines dental disease to a small early increment and thus reducing the loss of teeth. It includes a habit of periodic return to the dental office in subsequent years. But there are certain disadvantages also, like it is time consuming, attention to deciduous teeth, and increasing likelihood of interruption of child dental health program. So time consuming, the restorative dentistry is more time consuming on a piecemeal basis than upon a wholesale basis. So a large operative program can be handled on a quadrant basis under local anesthesia. This makes for rapid cavity preparation and easy isolation for teeth for filling procedures. 5 or 6 tooth surfaces can thus be filled in a time required for only 2 or 3 surfaces if these are scattered in various parts of the mouth. Attention to deciduous teeth. Much laborious restorative work may be performed upon deciduous molars at a time when the permanent successors have already started calcification and are controlling factors in mandibular growth. So financial resources may be exhausted even before the elementary school population has been cared for, and the permanent teeth might receive no care at all. increasing the likelihood of interruption in child's dental health program. Mobility of the children along with their families tends to interrupt program for dental and maintenance care. There is also a segment of population where systematic recall habits will be difficult or impossible to conclude. Throw it off. Comprehensive dental care is the meeting of accumulated dental needs at the time a population group is taken into the program, means the initial care, and the detection and correction of new increments of dental disease on a semi-annual or other periodic basis, which is the maintenance care. So, preventive measures aimed to minimize disease are a part of comprehensive dental care. So, services are provided which not only to eliminate the pain but also to restore serviceable teeth to good functional form, to replace the missing teeth, to provide maintenance care, and to provide preventive measures. So dental care from womb to tomb, this is comprehensive dental care. Thank you. Hope you like the video. Please don't forget to subscribe, share, and comment. Thanks for watching.